Good afternoon, ladies and gentlemen. Welcome to the Civic Space TV, and this is the chat show. This episode is live and recorded more virtually because of the ongoing trying as much to social distance. So we've decided to have this not as a physical engagement, but a virtual engagement. And it will allow us to proceed with our conversations. These are pertinent issues that we feel we need to share with everyone. So you need to keep on, we need to keep with you. Our conversation and our debate today is on the management of the pandemic and its effects on the civic space in Uganda. On my panel and joined today is, first I'll start with my guests, who is Dr. Issa Makumbi. Dr. Issa Makumbi is the head of public health emergency operations, where all aspects of the pandemic and the outbreaks are coordinated in the Ministry of Health. Dr. Makumbi, you're welcome, sir.
Thank you very much, moderator.
Yes, good to see you.
Nice to see you also. Thank you for having me.
Yes, while we wait also for Dr. Kamara along the way, I have Arinaitwe Rugyendo, who is been with us as a panelist. Is the CEO of Streamline UG, the young engineers in Uganda. Rugyendo, you're welcome, sir. You need to turn on your audio.
Can you hear me?
Turn on your audio. Okay.
That's the problem.
Yes.
I'm trying to find it. Can you hear me now? Hello?
Yes, I can hear you.
You can hear me. Okay, thank you. Sorry.
Good
evening, viewers, and I'm happy to be here. Thank you very much.
Network, but we can hear you.
Okay. Okay. And I said yes. I'm happy to be here. Good evening, everyone.
Yeah, thank you very much, Rugyendo, our regular panelist. Also, my other regular panelist is Joseph Ochieno. You're welcome. Is a leadership contestant with the UPC party.
Good to be here, and in particular, I want to welcome Dr. Makumbi, who's joining us for the first time.
Thank you very much, Joseph. Then finally is Sarah Bireete, the Executive Director with the Center for Constitutional Governance and a lawyer.
Thank you, Demian, and good afternoon, viewers.
Thank you, and thank you for being with us here today and this afternoon. Straight into the conversation, just a brief. The World Health Organization declared the outbreak a public health emergency of international concern on January 30th January 2020, and later a pandemic on 11th of March 2020. In Uganda, on March 21st, 2020, recorded the first case of the pandemic. The spread of the pandemic has had a huge implication, not only for the public health in Uganda, but touching all aspects of life, including human rights, governance, and democracy. And today we are experiencing the second wave. This has been around for over a year now. The pandemic has been with us for over a year. Straight into the conversation, I want to start with Dr. Makumbi, just to tell us what are the containment and mitigation measures that the government has put up in Uganda to allow for us to move on well as a country.
Okay, thank you very much, moderator. I am here representing my Director General, Dr. Masesa, who is unable to join. So really, before I tell you the containment measures, I want to emphasize to the audience how that the government is taking COVID as a very serious matter of concern to the country, and it's at the highest level of government. And I would like to briefly, before I tell you the containment measures, the governance and the coordination structures which have been put in place by the government. Of course, the highest structure for response of this COVID is at the presidential level and cabinet, where, of course, the president chairs the cabinet to look at all matters, followed by the National Task Force, which is at the office of the Prime Minister, who is the leader of government business. And this National Task Force is chaired by the Right Honorable Prime Minister. Below that, there is what we call the strategic group, which looks at strategies. And this is chaired by the Honorable Minister of Health. And below the strategic group, there is also a scientific committee which guides in the way we respond, so that we respond using science or scientific methods and information. And then below the scientific group, there is what we call incident management team. This incident management is at operational level. The other previous group were at strategic level. Now at the operational level, we have incident management team, which really does the operations, putting in context the policies, the strategy from the strategic group. And the IMT, or incident management team, has several expert groups, including partners, what we call subject matter experts, including partners. We have a surveillance group, a case management group, a risk communication group. We have also a logistic group. We have essential service group. We have an emergency management group. We have a vaccination group, and so on and so on. So these are really community engagement and social protection. These are expert groups which really go and dive in deep into these aspects of the COVID response. So if you want me to go through what the government is doing, or the containment measures, really they are grouped in surveillance, where we have alert management. That is, if people ring or say that they have the symptoms, we have that in surveillance and test using our lab network. We also do contact tracing, case management in our health facilities, in our hospitals, including home care management. We do vaccination, and we have put a toll-free number for the public to ask any question or to have any concern, so that we can address it either at the individual level or at community level. So those are some of the major containment measures: surveillance, case management, contact tracing, testing, and vaccination, and so many others, including risk communication, where we really tell the public the risks and how to avoid catching this disease. I submit, Chair.
Thank you very much, Doctor, for bringing us so closely, and also trying to give us the direction, and also trying to tell us what government is already doing in this in ensuring that there's containment. I want to bring this to Sarah, possibly. From your perspective, do you think that the objectives of the government so far have been met in ensuring that there's containment and mitigation of the pandemic at this level?
Well, thank you, Damien, and good afternoon, viewers, once again. I want to thank Dr. Makumbi for that brief, summarized detail, maybe I call it that, on the work that our frontliners are doing. And I wish to thank you and your colleagues in the ministry, as well as all other healthcare givers, in their efforts to save lives amidst this pandemic. Damien, it's important to note that the pandemic has new dimensions, new learnings in terms of management and containment and caregiving, and that poses challenges on its own. Uganda as a country was successful in containing the pandemic under the first wave. But I think after too much success, that almost suppressed the the infections of the virus. Because I think at one time we had empty COVID centers and no patients. So, but we sort of lapsed or dropped the ball and thought that maybe the pandemic had ended, both at the aspect of government and the citizens. Because it's important also to note that health is a personal responsibility, and the citizens must take care and follow all prevention measures. So I wish to gauge the response of government on a threefold. One is prevention, which we achieved. I would score 80% of prevention efforts under the first phase, and treatment, because anybody who needed testing and treatment under the first phase was able to access these facilities by government. Under the second wave that came with the challenging variants and different behavior, we see the government caught and prepared at several fronts. One, the health system or infrastructure is almost overwhelmed. We hear reports of no beds, reports of no medicine, reports of lack of protective gear for the frontliners. And of course, then we have challenges of vaccine, which are beyond the nation because of the politics and dominance of developed countries taking vaccines for their populations, because Africa, I think, has the least vaccination so far, and the efforts to access vaccines are limited with a lot of challenges with access. So, but when you come to the side of livelihood, and this goes beyond our guest Makumbi, because for them they are focusing on saving lives. Maybe what I would like to hear from him are challenges with access to treatment, challenges availing testing to whoever needs testing, especially the sick and their contacts, because commercial testing in this country is very expensive. I think the minimum cost is 150,000, and we have citizens struggling with the testing challenges. We have citizens rushing to self-medicate because of the anxiety of hospital bills, caused by hospital bills that we see. We see dead people being detained. We see demands of land titles by hospitals detaining the dead. So we have anxiety and fear amongst the community because everybody is struggling to ensure that they don't fall sick because of challenges of lack of beds, challenges of costs of treatment, challenges of hospital bills that are ranging between 2.5 to 5 million, and the efforts by government to make sure that they are on top of this situation, testing and treating citizens, like was the case under phase 1. And I would like also, beyond Dr. Makumbi, with the co-panelists, to discuss issues to do with the livelihood, because as much as COVID is a public health emergency, public health, for example, COVID also needs proper nutrition to boost immunity and help the citizens develop immunity and overcome the pandemic. But also we have challenges of people. In the first phase, 1.8 million Ugandans went into poverty. Right now, we have closure of businesses. In urban centers, 60% of the population work in service sector and industry. And the rate of loss of jobs was at 90% in these two sectors in the first phase. So how prepared are we to move forward as a country during the pandemic and beyond? Really, these are my first thoughts, Damien, and I hope panelists can help us get around these issues.
Thank you very much, Sarah. What I pick out quite clearly is that the government is almost overwhelmed at this point, and they seemingly about to lose it with the pandemic. I want to invite Dr. Makumbi again to just answer just a few of the issues that you've raised. Is government really in charge at this point, or you feel you're overwhelmed? Because we are seeing challenges around the hospital and how people are being affected.
Yeah, thank you very much, moderator. Of course, panelist Sarah is well informed, and of course, she raised the issue of treatment. The issue of treatment is everybody who needs that treatment, we should receive that treatment. And we have gone outside the box, or thinking outside the box, even establish non-traditional treatment centers. We have also gone ahead and involved and harnessed other resources in the country, like in the private sector. But of course, as she has already mentioned, the private sector has, there are some challenges there to access them. But again, the government has gone ahead to really regulate the price, so that really the prices are not hindering access. So for treatment, we have tried to make sure that we have systems which are there for somebody to access treatment. We have in the district, we have what we call rapid response teams. In the district, we have what we call district task force. These are on the ground to study the situation and create or establish solutions there immediately. If somebody needs treatment, is referred to the treatment center immediately. We have surveillance teams which can be looking at people who need admission so that they can get the treatment. On testing, we are not doing the tests as we want because we are limited by the reagents which help us to do testing for COVID. These are really on global supply, and you know, global supply has some limitation. So really, this is one of the beyond our control. But we try our best to make sure that anybody who needs testing is done, and it is free for anybody who has infection, who presents with signs and symptoms of infection. But if you are going out on some individual business, this way we ask you to pay so that for us we can concentrate on the Ugandan population which needs the testing, especially those who develop the infection or the signs and symptoms. So that is on testing. On some of the PPEs, again, this depends on global supplies. They are not in control. We don't manufacture these global PPEs or personal protective equipment. We have to import them. Again, the supply depends on the supply or the stock at a global level. So these all, but we do whatever is in our efforts to make sure that we really import supplies and distribute them by the national medical stores. Poverty, yes, I agree. Poverty has come in, but the only problem we have or challenge we have, the population thinks this is a government issue. The population should know that all of us are in this. If people followed religiously the SOPs, we would stem the transmission. But if the population is not cooperating, is not implementing the SOPs religiously, all of us are going to be with bloody nose. We need to work together so that we stem the transmission, and therefore we shall make sure that we go back to our business as usual. But as long as the transmission is continuing, I've not given you the picture. Maybe if the moderator gives me time, I'll give you the current picture. The current picture is bad. So if the community, the public can really cooperate and really implement these SOPs religiously, we can stem the transmission and control this disease or this pandemic to manageable levels. But there is now widespread transmission in the community because the community, the public is really indifferent on these SOPs, and people are dying unnecessarily if they had followed the SOPs. I will stop there, Chair, for any other submission, but I try to address the government is doing all its best, try to see, but as the panel said, some of them are beyond us. For example, we want to vaccinate everybody, but the supply is limited, and even where we are going to, where we had ordered from India, the India government closed it, so we cannot get the vaccine. So really, you can see that some of them are beyond our control, as the panel said, but we are trying to work with partners, with friendly countries, so that we can get these countermeasures for our population. I submit, Chair, for the time being.
Thank you very much, Doctor. I want then to invite in Ochieno, Joseph Ochieno. Can you kindly come through and try to analyze? Do you think at this point the government is in charge? Have they met the objective? We're in the second wave. Do you think they've tried to contain and mitigate this spread of the pandemic?
Thank you. I think I want to thank Dr. Makumbi for his thorough submissions. As you can imagine, the country, in my opinion, is in a state of panic. And even for me, who is relatively informed, hearing from him gives me slightly much more insight than I have thus far been able to receive through the various channels that government should be able to articulate to the public. So from a public health perspective, I believe that government needs to double its efforts in communicating with the citizens, especially if we expect a response from the citizens. If anything, at the end of the day, government is paid to do the thinking, the programming, and the implementing, and if you like, to treat citizens as babies, and as far as specialist issues and emergencies like this are concerned. Not necessarily that we as citizens should not responsibly and responsibly respond. And number two, I think also Sarah has given really, if you like, a summarized critique of this whole thing, because unlike many of the other subjects we would normally engage in the citizen space, this one is one which is very much a reality in which all of us in it together, in which even the angle from which I would normally take from where UPC would come, if you like, as a partisan thing, it does not apply. This is something that all of us should be able to rally around together and be able to see where really are the gaps, and if the gaps actually do exist, government or personalities and parties concerned, own up and together be able to try and make sure that we save lives. Now that said, it was interesting, just as I possibly thought, that beyond really the leadership provided from State House, I obviously clearly understood that there would be subcommittees that would follow. Now, considering, as Sarah said, that the first wave was generally very well managed, notwithstanding, again, some of the early experiences where we had, where, possibly the overreactions, particularly from the security services, in dealing with the public. But by and large, this one seems to be not only taking everyone else by surprise, but the state, in my opinion, nearly overreacted by, for instance, how the closures happened, how, and as we talk now, I have been seeing submissions coming from various parts of the country, including from my own native Tororo, which unfortunately seems to be bearing quite disproportionately the brunt of infections and, in fact, deaths relative to all the other parts of the country outside Kampala and the environs, which includes Entebbe and, in this case, possibly Gulu, for a reason that I slightly don't understand. Now, that said, it was very clear that it would appear that we unleashed young people, students, particularly from schools and institutions of higher learning, outside, into the communities. And there's Sabukat and Demiano, I have raised many of these other things, and many other people have done so. I think, in my opinion, that was a very clear failure of strategy. And to the fact that actually there is a specific group called Strategic Committee, how the Strategic Committee did not think and how the Strategic Committee did not advise at a huge corporate level about some of these impacts. I don't know, but as I say, it's possibly not about blaming. It's relieving that Dr. Makumbi has confirmed the fact that testing is free. And this is a matter that I see, and Demian, I think you and I in social media spaces where some of these things are very clearly stated that people are paying for this. I have a particular case, very close to me, in fact, where I came in contact with somebody who had all the symptoms. I pushed them to go and test and took them several days. And it would appear one of the reasons why they were reluctant to go and test, and this is an average professional in Kampala, one of the reasons was the relative cost implications. And I was quite surprised. When eventually it did happen, this particular individual turned out to be actually positive. So that to me is generally very much worrying. But the issue then of contact tracing, how that is generally working, again, from my own lived experiences, including my various contacts, it's almost like an unfelt. I'm yet to hear somebody tell me that they had been approached as part of contact tracing because somebody with whom they'd been in contact, like my particular case was, that somebody had tested positive, and so what happens? So I think to me, unless specifically that is well handled, we may actually elongate the pandemic and make it much more difficult for us to manage. Finally, the question of treatment. Dr. Makumbi again presents it rather well, as a matter of in a very reassuring way. But I was actually shocked that thus far, the reports that was brought out above all by the media, and that Sarah referred, how expensive it is, that private facilities, and in fact, in terms of the league of Dr. Makumbi, by the time you actually reach private facilities, you should really have gone through 1, 2, 3, possibly the 4th stage to be able to go to a hospital in which people are asked to pay up to 5 million Uganda shillings per day. So I think at this stage, considering that we don't know it is extremely important that government responds immediately to this very specific issue in a very public way. 1, their programs, 2, their strategy, and 3, the modalities, including the regulatory frameworks that are in place to ensure that some of the points that Sarah raised much earlier, do not continue to be part of a double tragedy for families and for communities. And in fact, if these are part of what most of us do know, even I, as late as yesterday at night, I get a message from, again, a very upper middle class Ugandan citizen who jokingly but seriously says, with the way these things are, just make sure you don't get it. Meaning, if you get it, you know the cost implications and you know the risks and implications involved. Now, for this panel, we are above average citizens. For the rest of the majority of Ugandans, they haven't a clue. And yet for those who are slightly below us in terms of our level of awareness, most people will be fearing. And so I worry that many people will be suffering in their families and possibly risking as they continue to infect others simply because of fear of either seeking treatment, seeking basic as testing, because they don't have any guarantee that there's sufficient organized support for them.
Thank you very much, Joseph, for that extensive brief on what is happening around your circles and everywhere. So I want to bring this a little to Rugyendo. Rugyendo, I've been seeing you quite involved in profiling cases of survivors of this. I want you to bring it to the House and the panelists here. Do you think there are stories that are promising that government is in charge, or people are on their own?
Thank you. I think I missed the first part of the question. The internet was not stable. Could you ask the question again?
Yeah, I was saying that you've been taking up the initiative of profiling cases. You've been profiling cases of those that have made through, have tried to fight the pandemic and have survived.
Yes.
I think at this point,
thank you very much.
Yes.
Yes. Yes. Actually, yes, the reason, maybe if I could answer that question very immediately before I go into the point I wanted to make. Yes, the reason we are doing it variously on social media and even in the media platforms that I run is basically to give support to the Ministry of Health and the entire structure that is running the task force by showing that by moving the narrative that this disease is defeatable, and we hope that when people read testimonies from those that have defeated it, especially people who are sick in their homes and in the different health facilities, they'll be able to learn. Sometimes, when you're faced with trouble, sometimes you need to hear from somebody who has gone through the same challenges, and that way you get inspired. It is possible to get out of this challenge. And that's the reason we are doing this. Because the social media and the other media, we are full of stories of why we are losing our comrades, our people who are close to us. It is here as hundreds of others that have defeated this disease, and they are here to tell you their stories that it's possible to defeat the disease. This is the reason, basically. However, I want to get to the point and appreciate Dr. Issa Makumbi, who has come. It's good, really, you've come, Doctor. You're most welcome. And I listened in, and when you listen in, you actually see a government that is trying to do its best. However, I don't see where he mentions successes. Are you registering? Are we moving, or we are all lamenting as a country and not seeing some clear, specific results out of certain key interventions? And while actually he was talking, I ran through my computer here, just to try to see, and landed on a study by certain scientists, and they are writing under something called MoH Hub, and they have profiled the first 5 countries in the world that have performed very well in fighting this pandemic, and they give reasons, and also the 5 worst performing countries, and the figures are very interesting. For example, they mention Mauritius as number 1 because they have only registered 1,300 cases and only 18 deaths. Other countries are Iceland, Singapore, Vietnam, and the reason, and New Zealand. The reason they give is one, and it's what you people have been talking about just a few minutes ago. These countries have a very robust feedback mechanism and communication architecture that keeps citizens informed. And this is basically what we mean really by civic space, that they keep the civic space open and responsive to whatever steps they are making. And I relate this to what eventually later I relate this to why Uganda is having challenges. And these countries implemented strict lockdowns, and people believed that strict lockdowns were important. They had a robust contact tracing mechanism. They had some way, of course, were quick to vaccinate their people, and they had good feedback. They have hotlines run by their security forces everywhere across the country in all their structures, and people kept indoors generally, and then they had this sort of strong leadership that people believed meant what they were saying, and ultimately they were able to implement the SOPs as laid down by the World Health Organization. And then when we look at the poor ones now, the poor performing, incidentally, number 1 is the United States. 32 million cases, and then 578,000 deaths. Then in that category, you have Brazil, you have India, you have Mexico, and you have the United Kingdom. And what did they do wrong? Ignoring SOPs. And here I agree really with the Minister of Health. SOPs is the only thing, is the only preventive measure that we can do to stop this. And in this country, it is very possible. But then they also, they are talking about poor leadership. These are democracies. have this fight with my sister Sarah. You know, these are clear-cut democracies, but the scientists have discovered that they exhibited poor leadership in management. Jones, you can clearly go about your business as usual, and they did not guide their people on what it means to run around SAPs and implement them. Then in cases of India, for example, they argue that they read well ahead of time. In the bus stations, in the taxi parks.
Your network is breaking. You need to be in one place.
I was saying, can you hear me now? Is it stable now?
Yes.
I hope so. Because I'm using my phone internet where I am located, but it's okay. And I keep getting disruptions from callers, but it's fine. And I was saying that in countries where there's poor performance, you have democracies where leaders now exhibited poor leadership in management of the pandemic. And in countries like India, which is the world's biggest democracy, Sarah, I think you know that, they are saying that the lockdown announcements were sudden, just like what has happened in Uganda. And I'm not surprised that we were able to, just a few days ago, the positivity rate had hit 17%. However, somehow, Dr. Issa Makumbi's people, I think, have done some work. It is now around 12%. But the problem was the sudden lockdown announced by the president, where he mentioned just at 6 p.m., at 8 p.m., he's saying things start immediately at around 10 p.m., and everybody was in a panic mode. And I think we lost it there. And people could not know, especially the children who are coming from schools whom we didn't have any idea had contracted the disease. And I think the spread to the village must be blamed by that sudden announcement. We needed to prepare the people. And this is what the scientists are arguing. In many people. I think, in my view, moderator, the question, I think Uganda, having performed in the first phase, in the first wave, I think gave a false impression that this thing was defeatable, and the analysts and the activists, as well as the human rights people like Sarah and the politicians also gave wrong messages to the people, that you see, these measures are being undertaken to simply achieve a political incentive for the incumbent president. And I think that message went down, and people and because by April of this year there were only 6 patients, COVID patients around the country, especially if you go by the public hospitals. The records show in the public hospitals there were only 6 patients. So there was this sudden belief that actually we had defeated the disease, and maybe actually the president was actually simply politically benefiting, and people were not warned that the second wave is going to be very, very serious. And I agree with Joseph when he says that we were caught unawares, and I think so. And I think really Dr. Issa Makumbi should really tell us exactly what really happened, because we seemed to have been caught unawares and prepared, and even up to now, the communication architecture around this is just, you see much of it coming from voluntary people like us and other media houses. There is no robust communication architecture going down up the village level to understand, to ensure that what we have actually is not the very first wave, which was only one variant. not even a variant, it was just COVID-19. But now we have a cocktail of 5 variants and we don't know. I have missed, for example, personally, as I conclude, I have missed this show for 3 times, I think. It's because I got a mild COVID. I did not understand it. I was testing negative, but I had all the visible symptoms. I did not understand until I started reading certain literature and discovered that I was a victim of the mild version, and I've been able to defeat it. But you imagine, I don't know what kind of information people are getting, and coupled with the cynicism around the country, and because of the signals that the state gives, the signals that the state actors are giving, they tend to delay information, and even when they are under attack, they don't want to correct the information. You've seen the cynicism on social media whenever something is announced, like the other day when they were announcing some kind of grant coming from World Bank, social media was full of comments from Ugandans themselves saying, now this is going to be stolen. This money is going to be, it won't even reach the last person. So you see, there is a way that Ugandan citizens have tended to give up and not trust what the government is telling them. I think that is the other challenge that Dr. Makumbi and team are facing. How do you deal with a population that doesn't seem to trust what the state actors are telling them? Why don't we probably get to the forefront people who are believable to be in charge of this fight, so that then the citizens probably can tend to believe, and then have more communication, not just one address every other second, with facts and figures, showing countries like I've just shown what do the poor performing countries did. What did they do that made them perform poorly? What about the best performing countries? What are the test cases? What can we benchmark? And how do we communicate that message in a simple way to the people to be able to embrace SOPs? Otherwise, I know that Uganda, like any other country, I don't think blaming people probably is the solution here, because this enemy is invisible. I think the point would be, how best do we ensure that speculation stops and people get convinced that actually SOPs work, that Tonsembera works, that they keep on masking up and social distancing and washing your hands if you have soap, and then those who cannot access certain means of survival under this lockdown, because that is what will force them to abuse SOPs. The state really has to come in and in an elaborate, transparent way to assist those vulnerable people with something to eat, with things that block them from abusing SOPs in.
Moderator, can I come in to
yes.
some of those
survive?
Yes, that's why I wanted to bring you in. Rugyendo, thank you very much for that. So, Dr. Makumbi, you actually in the head. You are the point where you're supposed to work with the emergency operations of these pandemics. Yes. And what comes out clearly here, especially from Rugyendo, is that there's communication gap. There's issues with communication. Yet, even in your first brief, you told us you outlined the structures or the kind of departments that are mandated to ensure that we are mitigating this pandemic. But again, we see the second lockdown seems like we have not learned any lessons from even the first from the first wave of the pandemic. Where is the problem?
Okay, let me thank and appreciate Rugyendo. Really, this is the kind of people we need, the people who lend a hand. We are very appreciative for that panelist, really, for that. He was also wondering, are there any successes registered? And maybe I just want to give him one example, that we have more than 75,000 cases cumulative, but more than 80% have recovered I don't know what you call that one. If you are looking for success, I don't know what you can talk about that.
Maybe
the issue.
Just a moment.
No, please let me finish. The issue.
There's something. It's just information. No, the success I was looking for was in the second wave. I know what has been happening.
Even in the second wave, people are recovering. So
yes.
The issue of leadership, the issue in Uganda, there is no question about the question of leadership from the highest level. In fact, one of the things we did in the first wave was that our leaders, especially our president, acted with speed and with the clear actions. So really for leadership, our president is looking at issues of self-sustaining, like we are working with the scientists to see we get some of these issues where we have no control on the drugs, on the vaccine. So real leadership is some of, to guide, the leadership to guide, think beyond, outside the box, inspire people. So the president, the leadership, that one, there's no question about that. We have very good leadership in this country as far as this is concerned. On the communication, in the office of the Prime Minister, as I said, there is a task force, and they are really committees made of ministers and directors, where really they look at key issues or certain areas. We have communication. We have a committee on transport. We have a committee on risk communication and informing the public. So really, one of the things, and as I said, this communication should go as far as the district level, because we're also contracting, even radios in the districts. They are giving free time. We have RDC free time. We have government free time. So all these are used to communicate to the people about, but if the real communication is not reaching, then really we need to study why is it not reaching there. Because as far as I know, we have done some studies, the understanding or the awareness of the disease is now almost 100% in the public. The preventive measures are 100% in the community. So really, communication is reaching, but maybe the practice is the one which is lagging behind. But communication, but I'll take it that we need to diversify the communication channels so that maybe the more concrete channels. I think this was also talked about by Joseph for the panelists. He talked about the communication is not really going deep in the ground. So that is something I am going to take back, that our communication it increases, using all the various channels, but the channels of social media, sometimes they are disturbing. They can be very good and can be very bad because they give wrong information, wrong messages. Instead of giving the right message to the people, they give the wrong. Some of it even is blaming, disgusting, threatening. So we really have to work together and you solve the communication problem. I think for the space, the civic space has been contracted or limited, and maybe we shall go that into. But there is a reason for that. There is a reason for that. There's freedom. The freedom of association has been limited, but not completely curtailed. There is still some kind of freedom of association, and you know the numbers for barrio, for whatever. They are limited and manageable, and you know they can help us to make sure that we implement the social, the SOPs. So it's not really completely that the civic space is really curtailed, but it is regulated. It is regulated so that we can stem this transmission. Panelist Joseph, really, I liked you. You said this is not a partisan. This is not a personal issue. This is a country issue, whether you are UPC, NRM, whatever party you are, this is not a partisan issue. And that's the problem we have, or the challenge we have, that some of the politicians, they send the wrong message. They send the wrong message to the population. And you know the politicians are influencers. So some of them people there, take their message as gospel truth when it is not correct. So really, you, the politicians also, you have really to work among yourselves so that you give the correct message to the population, to the public. Otherwise, if you say, this one is to benefit a certain political party, is this really benefiting? Is there is this disease attacking only one political party group? No, if this is a national issue, and Parent Joseph, you have already made a big point, a great point. This is not a partisan. Therefore, we should send very, very concise, similar message, which is not diverting population from the right action. The issue of
just right there. The problem is that the issue could not be the politicians, but you see, when you, the stakeholders, especially the government people, say, let's do this, and you're doing the contrary, then the politicians have to follow that. They say, no, you especially, and this we saw from the first wave, you say, no, we need to ensure that there's social distance, you don't go into public rallies, but you're having the primaries that are converging a number of people. So that's where the politicians, the opposition, have to chip into some of these weaknesses and utilize them.
I think, to the contrary, message were clearly passed by the government why they were advocating for those SOPs. That was really very well articulated by government, so that people take the right direction, take the right message, so that they can practice properly, a good practice, a positive practice. On the issue of schools, we weighed the advantages. People staying in a school was very dangerous because people were getting sick without letting the parents know, without letting the government know. They were concealing. And really, it was better that we close those schools so that at least we can transparently see everybody and deal with them as they are. If they have infection, we treat it or we control it. Otherwise, if we had not closed school, we would see massive death, and then again the blame would come to government. So really, closing the school is one of the measures to stem the transmission, so that people don't just die in mass. We have what we call emergency management system, where we have even ambulances to take people. If you know the toll-free number, you can ring and get assistance from the ambulance system we have. So really, moderator, I think the situation is not yet out of hand. We are really in control. And although we are also being overwhelmed by the mutation of the virus, because when a mutation comes, it comes with different characteristics, which again you have to adapt and deal with. But otherwise, the government is in full control, but in full control if the public really also behaves or listens to the correct message which the government is sending. Moderator, submit for the time being.
Thank you very much, Doctor. You've hinted on the issues of civic space. I want to invite in Sarah here. Sarah, but again, possibly I'm sure you're going to tickle Doctor to come back. The sudden pronouncements of the measures, they had an adverse effects on the different rights of the people. Do you think there is a possibility that the government will strike a balance in ensuring that these rights are protected?
Well, thank you, Damien. I want first to underscore the fact that in a public health emergency, the priority of government is to save lives. Now, whether the measures that government is using to save lives balances rights is the debate that I'm going into, and I will answer the claims by my friend Rugyendo. Rugyendo, there was nobody, no human rights activist misleading people. I think really we should distinguish between the excesses of security. You do not aim to save lives by killing people. Then what lives are you killing? Security killed more people than COVID in the first phase. Was that right? Is that something that you celebrate, Rugyendo? It is wrong. In this lockdown, security has killed 2 people. And I also know one person has killed the security officer. It is wrong. All our efforts should be aimed at saving lives. And
I want to come in here.
No, you are not coming.
Wait. You're going to come.
I want to correct the impression.
No, but they should kill people. Crime is them. And that is our argument. The World Bank
blame them. I said,
no, Rugyendo, you will have your time, please. You will have your time to respond. I am responding to your allegation that human rights activists were misleading. That is not true. Security killed people, enforcing SOPs. Even the president condemned it. It is wrong. The preoccupation of all actors is to save lives. So you don't get out of your way to kill under the claim of saving lives. What life are you saving by killing? No. And we did not contradict or mislead the Harris key messages. We were saying security cannot kill people. That had nothing with the work of Harris experts in containing and saving lives. Having said that, a pandemic, we are in second phase, and it's important to note, Damien, that whatever approaches we take as a country will determine whether we go into third wave or not. There can even be fourth wave and fifth wave, depending on how we respond as a nation. The key civic space issues that I would like to raise are rights of access to health, rights of women and children. We know freedom of association is constrained, and rightly so, because crowds are a spreading area for the virus, and I don't think anybody aims to crowd. In the first phase, we had many contradicting issues, including politicization of SOPs, where we saw security beating and torturing opposition leaders. And yet the NRM people were carrying on. Those were the contradictions of first phase. I do not want really to ride on them because we had an election. We are even lucky that after that election, we did not go into the situation we are in today. Elections ended in January, so nobody can even blame the human rights activists for the second wave. This is a lapse of 5 months. So I think let's discuss the situation the way it is today. There is a little improvement on the way security is dealing with people. People are able to access health because under the first lockdown, there was an assumption as if the only disease was COVID, and anybody else who needed health care that was not COVID was prohibited or had to struggle to get to hospital. The World Bank report has noted as much as Uganda in the first wave is listed among the top 10 countries that responded very well in containing the pandemic. The World Bank report has noted that for every adult death we saved, we lost 4 children as a nation. That is too much loss that could have been avoided. We are glad that during this time, the people are emphasizing the right of citizens to access medical care. The state is emphasizing the need to move so long as you can explain what you are going to do. Either you are a patient, either you are taking medicine or going to buy medicine. That was a part of the contradictions in the first phase, and I am glad that we are taking the lessons. I know people may be constrained by not being able to work or not being able to assemble, associate, and freely, express themselves. We have means of communication, so we have expression that is not affected, but assembly, the right of assembly, is affected, and rightly so. And I think for some time, it will be affected until the world is declared COVID-free. But what are our efforts of moving towards a COVID-free nation to ensure that we resurrect the enjoyment of these fundamental rights and freedoms? We know that we are beyond, and Dr. Makumbi will advise, we are beyond the stage of trace, treat, isolate, stop the spread. Because under massive community infections, we need to go beyond containment to look at mitigation measures, slow down the spread of the virus and mitigate the effects, but also reverse the pandemic by reducing the basic production number, reducing the abilities of the virus to multiply itself amongst the people. Lockdown was necessary, yes. I'm glad that people are free to move and access health care. Beyond those with health complications, any person can fall sick. So we should be able to have that leeway of free access to health. There are other effects of lockdown. People have lost livelihood. People will be unemployed. Yes, and that's where government needs to focus. How do you make sure that people are comfortable at home? As we see now, we still have a lot of people struggling to enter town in the morning. The reason is simple. People feeding from hand to mouth cannot sit at home when they have no food. So if we can have the relief fund being rolled out as urgently as possible, but government should not concentrate on the relief fund. We need to hear efforts of finding money to massively test and treat the population in order to contain and reverse the curve of the spread.
Thank you very much, Sarah. You're raising the issues that are pertinent that I possibly Doctor will answer, especially on livelihood, but this cuts across to all of us. I think all the panelists will have to have a take on the issues of livelihood. But let me bring in Joseph here. Of course, we are talking about the rights that are being affected here, but also importantly on the livelihood, the health rights. We are seeing the lockdown really affected the right to access to health. Do you think there is a way that government should play a part in ensuring that this is capped?
I think, as Sarah already suggested, it is the case that it would appear that amidst everything else, all the difficulties of the second wave, that they seem to have learned a little bit better lesson. And so there is a reasonable scope. I haven't heard or seen many cases of limitations of movements when it comes to, if you can call it essential movements, or indeed for people who basically need to be able to do it at this material time, because the balance which must be struck, and it's a very difficult balance at all, indeed. So I'm not quite sure whether there's necessarily thus far anything within the last 1 week that I would very majorly complain about. But I think I'll still go back to one thing, that it is the case that we are living too much on rumors in many cases and hearsays, which really is the responsibility of the state. But where I slightly disagree with Dr. Makumbi is that, even in fact in social media, and I think all of us, the panelists on this forum, Dr. Makumbi, we are extremely social media savvy, except that Demian beats me when it comes to the technical part of it. So we are substantially around social media and indeed broader media network in the country and generally globally. The issue is the messaging. Government is paid a huge amount of money, as I said, meaning guys who run government. State House has got communications chiefs and some of our former colleagues or indeed colleagues who get hugely paid to communicate. People with expert skills, by the way, Dr. Makumbi, to help you move your message. For you, all you need to do is to do your medical work and have the conversation around table with guys around your table who very quickly determine how to reach out to people. So the social media, which may or may not necessarily be that good sometimes, including with fake news, there is no reason. And in many times, the three of us, the panelists here, we've seen it first on some of the social media, the kind of thing that would possibly wait for the news headlines or breaking news. So it's not impossible for this very specific task force to up its game. All we're doing is to play advisory and support role on behalf of the communities and indeed as a backup to the state under these difficult times. That information flow is not, I can assure you, it's a bit of my job, by this, a bit of my training. It's not going on and as out there as well as it should be, considering the amount of skills and resources the state has specifically for communication. So that's number one. Number two, indeed, the discussion around civic space, which sort of pitted a bit of Sarah and my good friend Rugyendo, I seem to have seen him living. Maybe it might be part of his network, but we would like to have him back. Is that I think Sarah is right. We have had many cases where interventions by, Civic Space TV, for instance, some of the guys in civic organizations and community organizations, some responses from the media have in many cases brought immediate results. For instance, I think when the shambles of the announcements of school closures and upcountry trips did take place, and we refer to this, the messes that we saw on our television stations and what happened really at taxi parks and bus parks, compelled the response from the state. And indeed, we noted that the response was sort of fairly swift, but it was as a result of public criticism and indeed, in many cases, civic intervention. So it's very important. Number two, the point about schools, we don't want to go defensive about these things. Clearly, I'm quite surprised, and you're the public health expert here. I'm quite surprised, if it were the case, and I'm very concerned about this, that we knew children were sick at schools. What then was the role of the ministry and the minister for education? And which schools were these? Which school heads were these? Why didn't government intervene with all the powers that it does have? And if anything, going forward, are there any sanctions waiting for those school heads and those institutions that were putting forward profit before our lives? I think that's important. But obviously, it may not necessarily be a question for you, but that's a question that citizens of this country have got a right to be able to get answers for going forward. So number one. Number two, I think from a very practical point of view, and logistical indeed, I'm not sure if we knew that there were cases of COVID at particular institutions, that it was not possible for us to intervene by sending health experts. And with school administration, schools normally be homes of discipline, where you basically announce and simply say, class A line the other way, and you don't catch maybe 10, 15 COVID cases, isolate the rest of the other pupils and students, and save the country. I'm not quite sure. But those are really the kind of way in which we're looking at many of this. And for that reason, we sort of quite clearly faulted leadership. And leadership usually is not, again, necessarily political leadership. And Rugyendo was talking about democracies here. Indeed, America and Britain, America up to very recently, had a president who was a maverick, and quite clearly his messaging was in many cases worse than fake news. That is official. So it's not surprising that one, the public would lose confidence, but two, that global observers would actually fall to them. The same case with Britain. I'm very familiar with the politics of it, including in Downing Street. The guy who's there is almost like a mini laughingstock. Allow me, because I've got a bit of opportunity to be able to say this and say so both here and in London, that, he governs, but fortunately for them, they're democracy. But you know what? Those guys know that a funny guy will be in the State House or indeed in Downing Street in this case, but they can only go that far because systems work, institutions work, but the population will wait for the next 4 or sometimes 5 years and then deselect or indeed, basically deselect the leader in question. That's really not necessarily the case here, but we're not necessarily going political on that. I think very briefly, those are the issues from this point of view. Demian, it is sort of too early to tell what is happening up country, but generally around Kampala, I think I will take the line that Sarah's taking.
Thank you very much, Ochieno. You raise interesting issues that I'm sure Doctor would be willing to respond to. I will get to Rugyendo. I hope you're clear with your network. You almost went off briefly, but now you're back. You wanted to interrupt Sarah along the way, but then I stopped you. But there is an issue here. You think, how has COVID affected civic space in Uganda and beyond? You had a go on the human rights defenders. I want you to have a take on this. Your audio, try to turn on.
Yes, I've gone back now. So of course, yes. Before I even go there, there were two misrepresentations. I think one came from Dr. Makumbi. I am clear. I'm very clear about the issue of leadership and the way I explained it. I did not say there is a question of leadership in Uganda. I didn't say that. I was simply trying to give an example where has caused problems in countries that have failed. I wasn't saying there's something that has something to do with Uganda. No, I really think that the task force, COVID task force in Uganda are really doing their best and they're only facing a cynical population. And that cynical population has something to do with how the civic space is managed in this country. And this is where partly I want to agree with Sarah. Along the way, civic space and politics in Uganda have been, I would say, a 6 and 9, like the Wanyangwe would say. They don't see eye to eye, and in between, the population has been left to guess, to speculate, to exhibit negative energy towards the state. And Joseph and I have always been talking about how we can create another space where both positions can have a dialogue to be able to clear the space for the citizens to be able to express themselves freely. Because civic space is not even just about NGOs. It is about how I am aware of my rights and how those rights should be exercised, respected, and protected. That's what civic space is about. It's not about newspapers and NGOs, no. And so, therefore, before I even come to your question in relation to that, my sister Sarah, I did not say human rights really, human rights activists. I didn't say it the way you wanted to put it. I said they actually sent out a very, very bad message that really didn't give enough support to the people who are behind this fight. I know some human rights activists and politicians who are saying there's no COVID in Uganda, and they were busy actually undressing policemen of their masks. Really, the impression that was being given, really, and the actor and the activities and the actions that were actually being exhibited ended up forcing both sides into a contestation that exhibited politically. And for me, I think we need to interrogate the problem that comes with the state mixing health issues with politics. Because I think health, political activism, human rights activism, and then health enforcement, I think is always a contestation, because then once you have two political contenders in a given fight, and you have issues to do with the public health, there is always going to be a question mark. There's going to be a problem, especially, and a challenge on the side of the state, in my view. That is why, because of partisanship, political partisanship in this country, you see this is major coming from the state side. I don't see much effort coming from even civil society, even from the political opposition and the human rights activists. There's not much coming from there. I'm not seeing a convergence around this second wave. It's only Makumbi's people and others and the state. That shows you that the way the way the political class is viewing public health as regarding the fight against this second wave. And for me, it's quite unfortunate there, because we are talking about death here. And Joseph was very clear. He said, COVID does not know anyone, doesn't care whether you're NRM or NUP or CCG or anyone else, or Maria Barnett or anyone else. No, it doesn't care. And so this would be a moment when you're threatened with existential threat, death. It will be a moment for everybody to come in and do something about it. And then we can discuss politics later. But now that's not happening. And that brings me to the question that Demian is asking me, whether it has how has it affected civic space? And I think that's what has happened, because we've allowed politics to transcend public health. And
I think the issue of I think we are having.
Am I stable now?
Yes, but also.
Am I stable now?
Yeah, you're stable.
Having unstable internet, but also internet provision is also the other problem.
What I'm trying to ask is that you can't see these other players come on board when you have the government that is closing out everyone and issuing out only a few people as essentials. Then in the phase where everyone was locked down and they can't be part. Anyone who would come out was really handled in a different way. So how do you expect them to come out and play a part?
Of course. Now that's what I've just said. That you see, it's quite unfortunate that when you have an existential threat of death, you still want to talk about political partisanship. And for me, this is about science. In my view, this is about science and not politics. The list of essentials that you are talking about is not generated by political partisanship. It's generated by science, in my view. And this case, really, of course, the state has excesses. I must admit, really, Sarah, on this, really, I would agree with you that sometimes this is where enforcement of SOPs has reached excessive enforcement levels and resulted in some deaths and injuries, just because of poor briefing and poor appreciation of the situation of the crisis that we have at hand. But for me, the issue here is that I think the civic space, stakeholders in the civic space, who include even the state, must allow proper and professional dialogue to take place and engagement, so that then there is no suspicion that, because everybody feels threatened, so now the state has to use the opportunity to up its political dividend at the expense of the other side. And so therefore, I think that needs to stop. Even if I would want to imagine that the state doesn't really, or government does not have these intentions to use the fight to be able to benefit politically. I think the issue would be, I want to see because once the civic space, I think, is perfect, which again goes back to the other points I raised about the countries that did well, that are doing well, and the countries that are not doing well. There is that feedback mechanism. It has helped the first top countries in the world that have fought this pandemic. The feedback mechanism is a byproduct of a good civic space, of a proper civic space, of a well-nurtured civic space. That is once we have a poor feedback mechanism going towards the state, then that means that then there is a problem with the civic space, and that's where I think we should focus. How do we get everybody engaged? How do we get everybody to trust the people who are manning the task force in this fight? How do we get people to believe the message is coming from the state? Once you don't have that, once you have cynicism, once you have people who don't want to trust messages coming from the state, then it's time for the state to focus on civil society, to find out what could be the problem. Why is the political opposition not as enthusiastic as it was in the first wave? I remember Bob Wine came up with a song, you know. Where are these songs? What has happened to them?
I have an answer.
Of money. What could be the reason? So I think I would want to say yes. There could be there must be a chilling effect within the civic space that is catering proper feedback towards Dr. Makumbi and his team, and Dr. Makumbi and his team being just technocrats. It now needs the politicians. Now that we have parliament, a new parliament in place, I want to see the speaker rally both sides of the house to rally their sides. In the last election, we have 6 million people. We had 6 million people coming up to vote. About 3 million did not vote the current government in power, and this is significant. A significant following or section of the population where their leaders who probably enjoy almost a cult status need to come up and complement efforts of the technocrats, because I think saving lives is not a partisan issue, and also saving lives is a sine qua non for good leadership. So I think I want to see both sides exhibit good leadership in the fight against this pandemic.
Yeah, thank you, Rugyendo. And on the issues of being a technocrat, and also I'm sure Dr. Makumbi has accumulated quite a lot to respond to. But a quick question to Dr. Makumbi while you come on. Can we know the preparedness done by the Ministry of Health during the first wave, first phase, in terms of the beds and the other provisions that you had as the ministry?
Okay. Thank you very much, moderator. There is a comment you made that everybody is locked down. I want to correct you and tell you not everybody is locked down. Agriculture is not locked down. Media is not locked down. So if you generalize, you may confuse the audience. Not everybody is locked down. But on the preparedness, we have in my unit, we are also part of the people who are encouraging or spearheading preparedness. Of course, we had prepared, but the situation can overwhelm. Like it overwhelmed other countries. Very developed countries were overwhelmed. You think they were not prepared. And prior to that, we had done an assessment. And we really were, as we are addressing these gaps, then this man came. But as you know, this is a new disease. We're also learning as we are going. But we were also overwhelmed, but as other countries, but we are prepared. And for us, why we did very well in the first phase? Because we are well prepared. You know why? At that time, we are even responding to Ebola, which was next door to our neighbor. So really, we are already in a state of preparedness. Actually, it found us on the move. That's why we immediately went in and started controlling the pandemic. So really, the preparedness is there. But of course, our resource envelope, you know it. We cannot be like those developing countries. Our resources, we are limited resources. But even those who had resources, they were also overwhelmed. On the issue of
Doctor, right there on the limited resources, we've had the issues of the Auditor General's report and the issue and the gaps in the accountability. With the limited resources, why then we have some of these coming out?
I will not really go into that because that is a permanent secretary's question to answer, because I don't deal with the finances. But what I want to mention to Rugyendo is that this response is inclusive. It's not exclusive. it is inclusive. And you have labored a lot about civil societies. There's nobody who is locked outside. The response is inclusive. Please present yourself, and then you will be included. And we are working with civil societies. We are working with the Uganda Red Cross. We are working with the Living Pace. We are working with so many other civil societies. So there's nobody who is excluded. This response is inclusive. There's no exclusion. Anybody who wants to lend a hand is really very much welcome. And we welcome you with 2 hands. We are working with the partners who even sponsor, who support these civil societies. Otherwise, these societies, most of them are being sponsored by partners. So please know that there's nobody who is locked out. This response is inclusive, not exclusive. Rugyendo, you talked about rights. Please, rights don't stand alone. Rights stand with responsibility and obligation. I have a right also to live, and if you are not putting on a mask, are you really responsible? Because I'm violating your right, but what about you? I don't violate my right to live. So rights, human rights go with responsibility and obligation. So it's not one side of the coin. It's both sides of the coin. So please educate the public about rights. They should know the rights go with responsibility. On the issue of health and law, by the way, law is a tool for public health. You must do things lawfully, not according to your whim. You must do things transparently and according to established law. So that's why law is a tool of public health. We have Public Health Act, which helps us really to do what we are doing. So really, law, we should take law, very important. We take directives, we take policies as very important in public health because they help us to control or to stem transmission. On the issue of rumors, Joseph, really rumors, we have a committee, we have a public relations officer where we gather we look at all the social media messages, and those messages which are not correct, we take on remedial action and really correct the wrong messages. And also we have a social media point where also we interact with the public. So really, but both of you, Rugyendo and Joseph, you are really emphasized the communication is not deep enough. The communication, according to you, is still superficial, but this is something I'm going to take back. And I would like, Rugyendo, for you to give me your telephone and your email. I really connect you with the experts, our experts in communication, so that really you lend a hand or you give your advice. Because as we said, we don't know it all. You are in the community, maybe you see something differently, you have an angle. So we would like to work with you so that we deepen the communication in society. On the issue, Sarah, you really put it very well. There is a delicate balance between livelihood and death or disease. We must take a delicate balance to access. We must make sure that accessing health is very, very important. We have what we call now village task force. Those are in each village, there is a task force. Anybody in the village can access those and get access to health. We have what I call the emergency medical services. Again, this can help you to access health. We have a toll-free number, which can even this have some, even you have a national, which you can use and get access to health. We have a rapid response team in districts, again, which are accessible for you to get access to health. So really, accessing health should not be a problem. All those are measures you can take. LC1 will give you a letter, or RDC will give you a letter, even if there is lockdown and you access the necessary service. We have an expert group on continuity of essential health services. Their job is nothing but to make sure that all the essential services are continuing. So really accessing health is not a problem in Uganda. All those systems, you can use them and get access to health. For livelihood, of course, again, livelihood, we are very careful balancing. People have to eat. People need to go to access health. So markets are open, goods are transportable, borders can bring you. In fact, some of the districts, they have devised homegrown solutions. They have put up apps. You just ring and somebody brings something from the market for you. This is in Kampala. In National Market, you ring, there's an app you do, and you get your goods, what you like. So these are some of the innovations some of the district people are putting in place. So really, we need innovations. We need people like you there to give advice on how we can go about some of these issues to make sure that the civic space is really not so much compromised. But according to me, the civic space is really limited to the level where essential services can be attained or can be accessed, but at the same time making sure that we stem the transmission. I submit, moderator.
Demian, you are.
You lost Demian.
Demian, we have lost you.
Oh dear.
No, I am here. Sorry, by mistake I turned off my audio.
Oh,
sorry.
I'm giving authoritative person my contacts to Dr. Makumbi because I am very much interested in volunteering anything that I can manage.
Thank you very much. Doctor will share these contacts. Thank you very much, Doctor, for bringing this conversation into context and also guiding it further. So I want to bring in, I saw, Joseph, you had an interjection on something that, some issue that Rugyendo had pointed out on the media communication and the songs that were out. You had something that you needed to say about this.
No, yes, indeed, but it wasn't really very specific about that. It was about Rugyendo's suggestions about the cynical population and almost, minimally blaming the opposition and all the others. But before I do that, I just want to leave Dr. Makumbi with one quick question. Talking communications, because yes, it's very important. And Rugyendo and I see this from a very specific angle. There is this story about COVID-X, if you don't mind, for our civic communities. I don't think there is anybody watching who has not seen it into their inboxes. What really is officially the situation with COVID-X? Is it the case that Mr. Museveni indeed deployed his special securities around the guys in charge, and this is a medication that Uganda should be going around pharmacies and buy, and how much there? I think that needs to be very quickly clear. We just want to make sure it's not fake news. And indeed, if it's official news, then it's one of the examples where we're saying it could have been handled better. But very quickly, Rugyendo was talking about the cynical population. I just want to tell you one thing. I had suggested much earlier that this is really a question of leadership, and leadership in the broadest sense. Again, an example is this. In the very event that there was somebody else at State House, and this is not partisan, but just suppose it was a UPC president, not myself necessarily, the most likely thing to happen, and Rugyendo, you're a top media guy, watch how democracies operate. And I've been written about this. The very likely approach that was bound to take place was, before Dr. Makumbi, you get me on this, before Mr. Museveni went on television, he would normally have contacted his colleagues, his brethren, as what we would call them, key leaders of the opposition, and say, this is the situation, a briefing. This is the situation. This is where we're going at. This is what the experts are saying. One, either what are your thoughts? What are your contributions? Or generally, perhaps, I'm just giving you this for information because we possibly share our experts. Number two, we're going on for lockdown, and we believe, or I have decided, or my team is meeting tonight, what are your quick thoughts? That is what democracies do, and that is leadership. It did not exist, number one. Number two, therefore, going forward, in the absence of collegiate leadership, it means, therefore, that from young Chagulanyi or to whoever else out there you can call them leaders in both civic space and even the opposition, would just as much get what they got from television as anybody else. So really what is that they brief their people. The advantage is this, that if I had been approached or informed as leader of UPC, this is what we're going to do, and for reasons A, B, C, D. As soon as this thing goes on air, I have an idea, my team has an idea, perhaps I help to disseminate information through my own internal systems, that is reaching out to the citizens. Now, once the population know, and for instance, see, in fact, on a major event like this, Mr. Museveni, I know I'm giving the woman a very difficult job tonight, would possibly have been flanked by the two key leaders of opposition with him, giving him support, religious leaders, things like that. Of course, you can talk about social distance, things like that. But I'm just giving us an example. The country would see all our leaders together speaking with one voice. And it doesn't matter. It may have been something generated from Chad on the road, or indeed specialists from State House and backed by the Dr. Makumbis as public officials on behalf of our government and our country. It would not matter. Ugandans, ordinary citizens, would be seeing the population, that cynical population, would be saying, this is coming from our leaders from one source. And so we live with it or we die with it together. That really is what I wanted to say. And that is something which is so fundamentally missing, that beyond this pandemic, if the second wave, we've not learned any lesson. I hope there's no third wave. But going forward, I hope as a country, we need to be able to learn. And that's why I'm very much big on reaching a situation where at some stage in my lifetime, there's no third wave before this country begins to look at national issues as a matter of national interest and national security rather than partisan interests.
Yeah, thank you very much, Joseph. Trying to dig deeper, Sarah, I want to invite you here, digging deeper into still civic space. Can there be a balance between handling public health emergencies and the civil and political rights?
Well, Damien, yes. There is now a seeming balance as compared to first wave. On the issue of access, like we have all agreed and Dr. Makumbi has confirmed, access to health. On the issue of necessary movements being allowed, women giving birth, children, as a mother, I don't know how it happens. Children always fall sick in the night. After that, you just see temperatures of a baby rising and you have to wake up and move to the hospital. Whenever there are interruptions with the behavior of LDUs, my heart was always going out to pregnant mothers, to young mothers. Somehow things will always go wrong in the night. Then you have this ruthless security torturing a young mother. Most people don't even have means of movement. There are few people with cars, with even a neighbor who can wake up and give them a ride. So you first struggle with this movement. Then you get on the road, the child's temperature is shooting, and you are dealing with an unreasonable semi-literate LDU. People get desperate. I saw the incident in Kansang of a motorist who knocked down a policeman. Very unfortunate, but we are dealing with people. I have a friend whose whole family has tested positive for COVID. Imagine you are leaving hospital, your whole family has tested positive, and you are running home to pick something and you are also positive, and the security is stopping you. How desperate can you get? So these are issues that must not happen in the guise of fighting against the pandemic. People are fighting for their lives. People are mentally broken. People are traumatized. And then you have, I don't want to use, unreasonable words. This is a live television show, but the security please. Everybody is struggling to live. I am able to move, but I have seen, I don't think with the closure of most businesses in town and with the fear in the population, I do not think, save for the people who have no food at home, I do not think anybody can get on the road for no reason. I do not think so. So we need to have a humane approach. We need to understand that nobody wants to fall sick. Whereas before there was complacency, today we are all alive to the dangers of this virus. We are all observing soaps. Nobody is on the verge of committing suicide. Let's deal with the people who have no food at home. And let's understand that when an adult, I was telling a police officer, by the time I get out of my bed at 2 a.m. to go on the road, am I going in a bar?
Yeah.
I am carrying a child. Am I going in a bar or a disco? Is there any disco open? How can you misunderstand such urgency? It is not acceptable.
Yeah, thank you very much, Sarah. I see you've really got to the emotional bit, but at also at the point when we are closing, almost closing. So I want to bring on Doctor, and in 2 minutes, our time is fast spent. So each one of you will give their 2 minutes parting shots, but I will need to start with Doctor, and this is on livelihood. And everyone will have to have a go on this one. Does mitigating the spread of COVID require a balance to save lives and livelihoods? Doctor, I'll need to start with you.
Yeah, of course, yeah, definitely. We need to do that to strike a balance so that, we can survive the pandemic, so that otherwise, if we don't get that balance, some of us may not survive the pandemic. So that balance is critical, carefully designed to leave us a life so that we can maybe meet the next pandemic in 10 years' time or whatever. So really, I agree with you. We need to strike a balance. But before I do that, as I told you, I have another engagement, but I want to make an appeal. I don't know whether you'll allow me to make the appeal. Maybe the issue of what Joseph talked about. It's unfortunately that the parliament maybe had not been in place. But what I know that we have people on the opposite side. There is always alternate policy or alternative guidance on the opposite side of the government. So this maybe was not in place. So as this is not a partisan issue, so there is that leverage of the opposition giving an alternate policy. For example, you heard of the cash transfer. This is again to do with livelihood. Some of the people here are around Kampala and maybe Wakisomokono may get some cash transfers. But again, I had people saying, no, what about the whole country? So these are issues which can really be discussed and debated so that, we all are in this together and we move together in a consensus manner. So really the alternative is, but I know that the government has called some of the opposition leaders on certain meetings and they didn't turn up. But I'm not a politician. I don't want to go there. But just what he's saying, lobbying is very good. Lobbying, especially if the issue is non-partisan, lobbying to see what is the other side is saying is very, very good. But if you invite the people and they don't come, as I said, I don't want to go there because I'm not a politician. I don't know the reasons. But some people are invited and they don't go. The issue, I want to make an appeal, moderator, as I told you, I want to go away. The government really wants to appeal to the public to really follow the SOPs religiously And because this is going on television, specifically washing hands, putting on masks, social distancing, and no hugging. For individual, please don't touch men, meaning mouth, eyes, and nose. Coughing etiquette, when you are coughing, please cough in your elbow, or sneezing. When you are sick, please stay at home, self-isolate. When you are sick, seek early treatment. Please vaccinate so that we can stem this transmission. And also build your immunity. Eat a balanced diet and do exercise. This is really an appeal to the public to help us stem this transmission. This is moderator is the appeal I want to really to pass to the public, since this is going to be a public issue on the public SOPs, on individual responsibilities, and so on and so on. So really, moderator, if you could allow me to leave for another, I'm also going to do another assignment for another television outside the country. So if you could allow me to leave, I'll be very grateful.
Thank you very much. But one second.
Yeah.
The moderator, Joseph, asked about
Yes. Joseph, the president.
Yeah.
The president didn't say that you go and buy COVID. No. That is fake news. This will be announced officially, properly. I think the pharmacists are trying to use a selling language or something.
Yeah.
So this is fake news. This is fake news. The president has not directed that that's what you must buy. I thank you, moderator.
Thank you.
Thank you very much, Doctor. And possibly I might have to let you go at will. But then let me also invite in Rugyendo. I think you also need to take your 2 minutes parting shots on this issue of livelihood.
Is it me or I've finished?
Yes, you finished. Thank you very much, Doctor.
Best wishes, Dr. Makumbi. Best wishes.
Can I go off?
Yes, you can. Yes,
indeed, we've released you, sir. Best
Thank
wishes.
you, Doctor.
Thank you.
Thank you so much.
Thanks for your time.
Engagement and time.
Okay. I didn't get the question.
So, does mitigating the spread of COVID require a balance to save lives and livelihood?
Definitely it does, because you notice that in this country there are only about maybe 500,000 plus Ugandans who have a pensionable job and working with government. I was speaking to some of my colleagues who have relocated to the village, who work in government, and they have had to relocate to the village because whether they are in office working or not, they will still get a salary. They're not like us who are self-employed, where every morning you must wake up to think about how are you going to survive the next day. And these are the majority of Ugandans who are running shops. They're running simple, small businesses, they are chapati sellers, they are Rolex makers, vendors. And you and I am sure you, David, Demian, I know you run a restaurant and some other things which you have to be forced to close, and therefore you can't survive. So this is a very important issue, and I hear actually there was even a debate between the president and the task force composed mainly of scientists, but not necessarily even scientists, but majorly people who are gainfully employed, and this is the problem that the enforcers, SOPs enforcers are facing, because you have on one hand the people who are shouting SOPs are people who have a meaningful job. They have, whether they have worked or not, the government will send their salary every 28th of the month. Now the other majority have to survive on the sale. If you don't make that sale, you'll not earn that commission or you'll not earn that salary. And this is the dilemma that this country is facing. And I would agree for those who are advocating for balance. But to have the balance, we also need to achieve that minimum level of mindset change. in which people now begin to understand the importance of SOPs. If the country, if all of us can demonstrate that we will respect SOPs, there's no reason why even shops should close. Why should they close? As long as we are all disciplined. And I think the problem that we have
I think we are losing Rugyendo, and our time is running out. I think Joseph to take it on from here in 1 minute.
Yeah, I'll make it less than a minute. No, quite clearly, yes, it's common sense. The balance must be the right way forward. And I think, like Sarah said at the beginning of this conversation, in fact, if anything, livelihood, in the broader sense, is possibly more important, because if we put the context of livelihood at the center, then lives will be saved. What are we saying? We're simply saying that, well, in seeking to protect lives around this, we must remember that the bottom line is the context under which we are doing this. So naturally, I think Rugyendo's places it quite well. If only the chiefs were able to listen to him on how to strike a balance. One of the other things, of course, is that there's this rumor going around about call it rumor, word that maybe Demian you know better about the 500,000 shillings, which is going to go into people's mobile phones. Now, what criteria that is going to be applied, or I do not know. I think this is a hint. Is it going to be urban? Is it going to be everywhere else? Things as basic as that. I think generally for me, I am much more interested in how the whole program came into being, how it is now going to be reasonably enforced, and how, therefore, as all my colleague panelists suggest, a situation in which somebody who runs a decent restaurant on average, in a particular corner of town, if only, they are allowed to reason out with the authorities that, look, this restaurant can operate, it can be sustained, I can manage it, I can engage with the staff, and indeed we can actually continue to provide services to the people within reason. I think that to me would be much more important. Again, like Sarah also said, if then it is a case where somebody is seeking an urgent attention to move, it's normally not even health. Sometimes it may be tragedy. Sometimes it may be anticipation of health and or tragedy. Some of those things about how reasonably balanced we are about these things. Yes, it is the case, as I understand it, that the authorities may be slightly more organized, much more tolerant this time around than before, and I hope and may it be that way. It's unfortunate we don't know what the latest figures are. If any of you guys know, I'm very much interested.
Thank you very much.
Beyond that, I urge you all to stay safe, because it seems to be very serious.
Yeah, thank you very much, and thank you for that last shot. Sarah, will you come in and give your parting shot?
Well, it's important to ensure livelihood for people, because even poverty kills. Although the disease would be in a much shorter time, poverty kills. Anxiety and fear and hunger kill. So when you stop people from moving, the government actually, it is now 1 week under lockdown, because we started it was announced on Friday. Yeah, just tomorrow we are making 1 week. But when you hear about the preparedness of government, I think they are waiting for Monday to go into cabinet, and then that's when they will know what they are doing. But also my second worry is the way the technocrats had made the budget for this year. I think there is need to review all activities that were meant for the first quarter of the financial budget. Because in that budget, there is very little money to do with COVID. And this is a budget starting next week, the month of July. There is little money for COVID. And even immunization, there is only 500 billion for immunization. It's not enough. So we need to suspend things like construction of roads. You cannot construct roads when people are dying. We need to suspend money that was meant for travel and workshops and other avoidable expenses, including scaling down scaling down on activities, and find money for mass treatment, mass testing, mass vaccination, as well as saving livelihoods and the economy of this country. I thank you.
Thank you very much, Sarah, and all my panelists, Joseph, Rugyendo, the other guests that have come in, Dr. He has left, Dr. Issa. Thank you very much for being with us. This is the virtual engagement that we've had into the second phase of the lockdown, which has affected our physical engagement. But also we need to thank the panel, the audience that was always with us, glued with us and following these conversations on Civic Space TV, chat show. Thank you very much for being with us. Kindly, this discussion will be on every Friday. Regardless, we shall always be here and have these conversations reach you. This information will always reach you. Reach out to our hashtag, the chat show UG, and just drop in your comments, your comments, your observations and everything, so that we need to stay safe. We need to keep with us, and also as citizens, we need to keep safe with this pandemic. Thank you very much for following the conversation, and we hope to meet next week. Thank you. Good evening.